All right, if you're heading outside these days, you're sneezing, because I know I'm sneezing. Springtime allergies are already here, even with the colder weather this week. So this picture really sums it up from this past weekend. Snow plus pollen equals spring in North Carolina. Great. All right, so today, answering all things allergies is Dr. Erin Dennis with Allergy and Asthma Center of North Carolina. All right, let's just get started here. Is allergy season starting earlier? Because all the rest of us feel like it's starting earlier than it has been before.
Yeah, so thank you guys for having me. And yes, it has definitely started earlier than normal. You can see it with the trees budding and the plants blooming, and it's just out and about. So it's here. Spring is here.
So does that mean it's going to be worse than normal, or that's not an indicator?
So that's a great question, and we don't quite know the answer to that yet. It's something we're going to have to trend, but because of these warmer climates, what we're suspecting is that yes, we're going to have a longer pollen season, and also that our pollen counts are going to be higher. So time will tell, but that's what we're suspecting.
Okay, so here's a very common question that we get all the time. How do you tell the difference if what you're experiencing is allergies or something else, especially if you're someone who hasn't maybe had allergies before?
That is also a great question. And I think, a lot of things are going to overlap when we're thinking about colds maybe or allergies. So you can still have, the runny nose, the watery eyes, the sore throat, sneezing even. And those can happen with both of those things, but there's two main distinctions that I like to tell my patients about. So number one is if you're having fever, that is not going to be an allergy. So if that's occurring, think more, okay, maybe I have a respiratory infection, maybe I have a cold. And the other distinction is, are you itching? Because oftentimes with allergies, that is going to be a main symptom. So it's the itchy eyes, the itchy nose, the itchy throat, itchy skin. So hopefully that'll help people kind of differentiate between the two.
Absolutely. So fever, definitely not allergies, and itching, definitely allergies. Okay. Now, if it is seasonal allergies, how long are those symptoms going to last? Like you said, the itchiness and the watery eyes and all that?
Yeah, so this is going to depend really on each person and what they're allergic to. So if you're someone who's just allergic to tree pollen, you might be, symptomatic all during the spring. If it's grass you're allergic to, then we're looking at summer. If it's weeds, that's the fall. And then there are folks who have all of that, plus, they have annual allergies. They're allergic to dog, cat, dust mites. So that's where allergy testing is helpful for us.
Right, to really figure out what the issue is so that you can treat it the right way. Which leads me to ask, what can people do to get some relief and lessen the symptoms of like the seasonal allergies?
So there's a lot of great over-the-counter options that people can try. If you head to the allergy section at the pharmacy, you can see lots of antihistamines. Again, here, some helpful tips are make sure you're looking for antihistamines that don't make you drowsy. So some of the newer antihistamines are not going to have that side effect, and they're going to last longer as well. So you're going to get longer control of the symptoms, and you're not going to feel groggy when you're trying to make yourself feel better.
Okay, well, let's talk about that a little bit, because when you go and you do get the over-the-counter thing, you're thinking to yourself, all right, how long is this going to last, and how do I know if it's actually working? Like, how long does it take for me to know that allergy medicine is working?
So the onset of action of these medicines is typically pretty quick. So you should know within a couple of days if it's helping or not. And then if it does help and you feel like you need to take it every day and that controls your symptoms, we have a lot of patients that need to do that. And if you're not sure, then that's a good time to talk to your primary care provider or come and see an allergist.
Okay, so you at least need to give the over-counter medication a couple of days. It's not going to be instant, a couple of days. And if it's not working, you should try maybe something else.
Yes.
Okay.
That is correct.
All right. So if those medications do help, do you, like you said, you could take it all season long, or you could just take it here and there?
Yes. So it's going to depend sort of on your symptoms and how severe they are. So again, some people need to take it every single day to keep their symptoms under control, and some people can just kind of take it here and there, and that is all that they need.
And unfortunately, that's just kind of trial and error. So you may, feel sniffy and sneezy for a little while you figure it out. So are there changes to, let's say, like our daily routines that would also help with the allergies?
Yeah, so there's a lot of great things that we can do that aren't medications to kind of help eliminate some of our exposure to these allergens. So things like, if you don't take your shoes off now when you go indoors, you can do that so you're not tracking pollen all through your house. Same thing if you have indoor, outdoor pets, you can wipe them down when they come in, wipe their little paws off. Some people will even change their clothes when they come in. Some people will take a shower just to rinse all the pollens off of them. So those are some great things that you can do too to help reduce your exposure to allergens.
All right, because we're all sniffing and sneezing and wheezing, we're going to continue this conversation after the break. We'll be right back. All right, welcome back. Dr. Erin Dennis is here talking all things itchy and sneezy and wheezy. We are definitely talking about seasonal allergies. All right, this is something that people talk about all the time. Is it true that like taking local honey can help you with your local seasonal allergies?
So I really wish this one were true because I love honey and I certainly love to have an excuse to do a teaspoonful of honey every day during the spring, but this one is actually a myth. And the reason for that is, the pollens that cause us to have allergies are going to be wind-borne. And they're tiny pollens. They travel for miles and miles. It doesn't matter if you're near it. But with honey, the bees that's going to be bee pollinated or insect pollinated pollen that's in that. And that sort of pollen is very dense and heavy, and it just really sticks to the plant. It needs those insects to move it around. And that's not what's causing the majority of our allergies. So unfortunately, that one's a myth.
Okay, gotcha. All right, good to know. All right, what about the neti pot? Is there a right way or a wrong way to use a neti pot?
Okay, this is an excellent question because neti pots are a very useful tool, especially if you've got sinus congestion, but there's definitely a wrong way. We all hear, several times those rare cases where people have died from it, and it's because they're using tap water. So if you're going to use a neti pot, make sure you're getting distilled water, or if you use tap water, you need to boil it first for a few minutes, let it cool down because we don't want to scorch your sinuses, and then after that, it's safe to use. But before that, it's an absolute no tap water in the neti pot.
Yeah, because you're putting it right there into your nasal cavities, and it's kind of like sitting there for a bit.
Yeah, it is, and the problem is if you use tap water, you have the risk of getting bacteria from the tap water in your sinuses, so definitely don't want to do that.
Okay, all right, so with the warmer weather, people are doing yard work, they're exercising outside. What recommendations do you have to help with those seasonal allergies with these types of activities?
So, one thing is either do it really early in the morning or late at night to try to avoid the high pollen counts. If you're doing yard work and you can stand to wear a mask while you're doing it, that will certainly help. If you want to wear sunglasses, if your eyes bother you, that'll keep the pollen at least out of your eyes, so that might help some as well.
All right, and is there a common myth about allergies or treating them that you want to just set straight? I know we set the honey thing straight, but there's probably something else out there.
Yeah, so I think one of the major things that I see with patients coming in is that they go to the store and there's so many options to buy, and decongestants, people love to get decongestants, and they're great if you're just using it for a couple of days. But if you get decongestants and you stay on those for more than 3 days at a time, what happens is your nose basically quits doing what it's supposed to do, and it quits decongesting on its own. And so these people are coming in, they've been using it for weeks or months or years even, and they can't figure out, why their symptoms aren't getting any better. So it's because, they're using the wrong medication. So definitely want to make sure that you're not getting the Zyrtec D, the Claritin D. Afrin is a huge one that I see people pick that up, when they're grabbing nose spray. So make sure you're getting the right stuff.
The antihistamine is what we're looking for.
The antihistamine and really nasal sprays are an excellent first-line option, and the ones you want to look for are the ones that have steroids in them, because that's going to lower the inflammation. And I think people try to, kind of shy away from nasal sprays. Maybe they don't like using them, or they just don't think they're effective, but it's really a great tool as well.
Okay, and if you're concerned that you're experiencing allergies maybe for the first time, who should you contact?
So I think, if you're not sure and you want to speak to someone, your primary care provider is a great place to start. And if you don't have one, you can go to conehealth.com/appointments and get set up with someone there. And if you have allergies, or you've been trying the allergy medicines, they're not working, or maybe you just want to think about other options besides just doing the over-counter stuff, then that's a good time to reach out to an allergist.
All right, really quickly, at what point would someone need to go to the allergist?
So again, if they're using those over-the-counter medicines and they don't feel like they're effective, or if they're just tired of taking medicines all the time, then that's a good time to reach out to someone, and we're always happy to help.
All right, well, thank you so much. And if you missed any of today's Q&A, head over to the WFMYnews2.com website, click in the To Your Wellbeing section.